Welcome back. A fourth edition of the Ritshidze report details the state of the public healthcare system in the Northwest. While some improvement has been made, long waiting times and ongoing stockouts persist, and too few people are getting longer ARV refills. For more information, we are now joined by Ndivhuwo Rambau, the project coordinator for Ritshidze. Thank you so much, Ndivhuwo, for your time and for joining us. What are the main factors that you found out of this report that are contributing to these long waiting queues that are experienced by patients, especially in those clinics in the Northwest? And how has this impacted access to healthcare services?
Okay, so thank you and good evening to all the viewers. So the main reason, or one of the knock-on effects for long waiting queues at the facilities is the staffing crisis. 69% of people blamed that there is not enough staff, or the staff is not equipped enough within their facilities to be able to service people on time. In addition to few staff, 37% of people also blamed the staff for either working very slowly or taking long tea breaks or lunch breaks during the course of the day while they are there to access services.
Now, I want us a little later on to touch on those specific experiences that patients that you've engaged with are experiencing, but how have the inadequate ARV refills at these facilities affected the continuity of care, especially for patients living with HIV and AIDS in the province, and what are the potential consequences of this particular issue?
So one simple solution to reduce waiting times in facilities is to give people living with HIV longer ARV refills. This way, they come to the clinic far less, and it's also recommended in the National ART guidelines. However, the implementation of such really does vary across the province in Northwest, where we found that Dr. Kenneth Kaunda wasn't doing very well in this regard. So giving people a longer supply of ARVs means that it's fewer visits to the facility. It also makes medicine collection for people living with HIV much more easier. And I think most importantly, it would also reduce the burden on congested and overstretched facilities as well.
It's very interesting that you should mention that a facility such as the Dr. Kenneth Kaunda is unable to give those refills, but then you'd have a contrast in the same province such as Bujanala who are able to do that. Why do you find that these facilities are so different in how they implement something that would reduce those long waiting queues?
So in some instances, we are told about the overall stock that facilities have on them, and that would be a main concern, that if you are giving out too much of a supply to patients, for example, it would mean that the patients wouldn't be able to get it. But we've given recommendations on how that can be implemented better, and we've also asked Aurum, who is the DSP, the district support partner in the province, to also come in and play its role in ensuring that people get a 3 to 6 month ARV refill length at a time.
Ndivhuwo, this is the fourth edition of this report. Are you seeing the implementation of some of the recommendations that you've made in previous reports? Are there any improvements?
So there are some improvements, or rather I can say that some of the recommendations that we've put in place are still in part. So for instance, in instances like around staffing, where we've asked the department to fill all vacancies and establish new positions. Since 2021, that hasn't been done or implemented, or even hiring the sufficient numbers of healthcare workers. In some instances, that has not been implemented as yet. But when it comes to waiting times, we've asked that facilities use appointment days and times. We are seeing that is starting to be implemented, so that recommendation is still in part. Similarly, we've also asked that they ensure that facility pickup points are a one-stop, very quick, art collection only visit. That's also in part. So there are some recommendations that we also see that are being put in place, but it's just that it's going rather slowly. It's not going at the pace that we would have wanted to ensure that people living with HIV still have their dignity intact. We have facilities that are not so congested by people who are just coming to collect their ARVs and leave. And in that instance, staying at the facility the whole day just to collect your medication as well.
I mean, some of the highlights there are, of course, the long waiting queues and the ARV refills. What strategies or interventions then have you proposed in this report to address these challenges?
In terms of the waiting times?
Yes, and the collection of the ARVs.
So in terms of art collection, the main recommendation is that they should ensure that all eligible people living with HIV get a 3-month supply of their ARVs. And this is also required in the National Art Guidelines. We also ask that the Northwest Department of Health better support the stock management to ensure that there are enough ARVs at the clinics to ensure that people are able to get the 3 to 6 month supply. We've also asked that the department release the CCMDD numbers of people on 3-MMD, 4-MMD, and 6-MMD by facility so that we can actually see those numbers. And 10% of eligible people living with HIV should receive their first 6 month supply. With people getting a longer supply, you really do decongest the facilities. And we also ask that we have more external pickup points where people can go and collect their treatment. And these pickup points should also be made available in urban and rural areas as well, that we don't only find external pickup points blooming in our urban areas only, but also be extended to rural areas as well.
Any role that you see that technology can play in streamlining healthcare services and reducing waiting times?
I think when it comes to filing systems, where a lot of community members indicated that, look, I went on a certain day, I got to the facility and they could not find my file. So having one database where we can have all the filing system, everyone's records on, one touch of a button would really make a difference in waiting times as well. Because in some instances, patients will tell you that, look, I've been here the whole day, I got here at 7 o'clock, they can't find my file. So having that one consolidated system would really go a long way in ensuring that people get to the facility and are seen on time and are able to go back home, because patients, people who are going to consult, people living with HIV also do have lives. And and community members have indicated that, it almost feels like just because I am living with HIV, it's like I no longer have a life, that I'm expected to come to the facility and spend the whole day. And us raising these issues with the Department of Health, even the National Department of Health, is not that we are pointing fingers or we are challenging or we are fighting. We know that there are healthcare providers who are doing an excellent job. And this is not to discourage them, but it is to further improve the healthcare system in the country.
Most certainly. We do hope that this 4th edition of the Ritshidze report really does do that, to give information and data to healthcare providers, all the stakeholders within that sector, in order for them to give an improved service. Thank you so much for joining us and for your time this evening. That was Ndivhuwo Rambau, who is the Ritshidze project coordinator, speaking to us there about the 4th edition of that report and its recommendations.